Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life and Balance. And today we're going to talk about cardiac stenting or percutaneous coronary intervention. And that's where they go in and they put a balloon and sometimes a stent in to hold open an artery that might be blocked. And there's been some challenges with this procedure over the years in that largely in non-emergent, so these aren't people that are in the middle of a heart attack and heart damage, but in non-emergency scenarios, largely what the stents do is they prevent and help with chest pain. They don't really change the long-term trajectory of somebody needing to have an open heart surgery. I think for me, part of that's because it's easy. Go in, you don't have to have your chest cracked open and all the rehab associated with that. And maybe people don't make the lifestyle changes that they really need to make, and maybe it wasn't stressed to them because the PCI, the stenting procedure, was so quote-unquote easy. So in this particular study, it was a study looking at almost 12,000, so 11,730 people. They followed them for an average of 5 years, and these were people with stable ischemic heart disease. So basically, there was no recent or acute changes to what they had. They had heart disease, it was known, but it wasn't progressing, it wasn't emergency. And these people also had no chest pain, no dyspnea, no difficulty breathing, which is what dyspnea is. That can be a sign of having a heart attack. And of these, 1,317 were asymptomatic, so no symptoms or anything. And it turns out that the people that had the stenting done did much worse if they were asymptomatic, which is strange. But then looking at the asymptomatic people, they were more likely to have, first of all, have complications during the procedure, have a higher 30-day risk of major acute coronary events, and higher mortality, like 27% versus 18% over the study time. What they did find was generally the people who were asymptomatic had, they were generally older, male, triple vessel disease, and more comorbidity. So these were sicker people, but they were asymptomatic. And I don't really have an answer as to why these people did poorer during the procedure. Maybe they were just, with all these comorbidities and the age, that they were just, it was too much for them to handle the procedure. But the reality is, we still do very poorly in managing cardiovascular disease. And it's almost entirely a lifestyle-mediated scenario, and I think we are doing a very poor job of communicating how we need to improve cardiovascular health. And I've certainly written about this. There's 7, the American Heart Association has 7 ideal cardiac metrics that are not very hard to meet, and yet despite being easy, despite being very, very linear, very small percentage of people actually live by these 7 healthy guidelines. So these are definitely things that need to change. But as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.